Hi, my name is Brittany Neely. I'm a graduate student at Indiana State University. Today I will be speaking to you about the smoking epidemic in the United States. Cigarette smoking is the leading cause of death in the United States. It accounts for 1 in every 5 deaths. Smoking causes more deaths each year than the following causes combined: HIV, illegal drug use, alcohol use, car accidents, and gun incidents. As a result, smoking is our nation's most significant public health issue. Some health risks of smoking include lung cancer, cancer of the throat, stroke, heart attack, macular degeneration, chronic bronchitis, pneumonia, asthma, preterm birth, erectile dysfunction, and many more. In addition, smoking has been shown to increase the risk for coronary heart disease by 2 to 4 times, to increase the risk for stroke by 2 to 4 times, and to increase the risk for men developing lung cancer by 25 times, and for women developing lung cancer by 26 times. Smoking causes 80% of all COPD, which is chronic obstructive pulmonary disease deaths, and 90% of all lung cancer deaths. More people in the United States have died prematurely from cigarette smoking than have been killed in all of our country's wars combined. As you can see from above, cigarette smoking in the United States is the highest among certain populations. For example, 34% of adults with a GED certificate smoke, as compared to 3% of adults who have a graduate degree smoke. Those below the poverty level are twice as likely to smoke than those who live at or above the poverty level. Other populations reporting the highest rates of smoking include males, adults between the ages 25 and 44, adults with a disability, and adults who are lesbian, gay, or homosexual. The Midwest reports the highest prevalence rates of smoking, as you can see by the graph above. In 2015, 26% of adults in Kentucky were current smokers, as compared to Utah, where only 9% of adults were current smokers. As for Indiana, the prevalence rate for cigarette smoking in 2015 was 21%. Cigarettes were invented in the 1880s, but their popularity did not occur until 1913, when Camel and other brands began mass marketing campaigns. Cigarette smoking continued to flourish during both of the world wars, when free cigarettes were distributed to soldiers. It was not until the 1960s when cigarette smoking finally began to decline. This came after the U.S. Surgeon General released a report with evidence concluding that cigarette smoking caused lung cancer, chronic bronchitis, cancer of the mouth and throat, and was also associated with heart disease. Cigarette taxes and smoking bans over the years have ensured that cigarette smoking trends continue to decline. According to the CDC, secondhand smoke is smoke from burning tobacco products, such as cigarettes, cigars, pipes, or smoke that has been exhaled or breathed out by the person smoking. Since 1964, approximately 2.5 million non-smokers have died from health problems resulting from exposure to secondhand smoke. As you can see from above, secondhand smoke causes SIDS, respiratory infections, ear infections, and asthma attacks in children, as well as heart disease, stroke, and lung cancer in adults. The total economic cost of smoking totals more than $300 billion per year. This includes $170 billion in direct medical care for adults, as well as $156 million in lost productivity as a result of premature death and exposure to secondhand smoke. In addition, $9 million was spent on cigarette advertising in 2014. This is nearly $25 million spent every day on cigarette advertising, which is $1 million spent every hour of every day on cigarette advertising. On average, a non-smoking adult pays $52 per month for life insurance, in contrast to a smoking adult whose monthly life insurance premium costs $289. Over 20 years, a smoker will pay nearly $57,000 more than a non-smoker for life insurance. Efforts to settle cigarette smoking include taxes and youth access laws. The Indiana state tax per pack of cigarettes is $1, which ranks 37th in the United States. The national average cigarette tax is $1.71 per pack. The highest state cigarette tax is New York, which comes in at $4.35 per pack of cigarettes, and the lowest state cigarette tax is in Missouri at 17 cents per pack. In addition to high taxes on cigarettes, the minimum age requirement to purchase cigarettes is 18 years old in an attempt to keep minors from picking up this habit. The prevalence of cigarette smoking in Medicaid recipients is twice as high as the prevalence of cigarette smoking in privately insured American adults, which makes this an existing challenge for public health workers. Smoking prevalence in other insurance groups have showed significant declines in recent years, while the smoking prevalence in the Medicaid population has not. Medicaid smokers are less likely to quit than those in other insurance groups. They are also more likely than other insurance groups to have chronic diseases and to experience severe psychological distress. The 2014 Surgeon General's report estimated that smoking is responsible for 15% of Medicaid cost. The unchanging smoking prevalence in the Medicaid population remains a challenge to our government and public health professionals. The statistics highlight the opportunity that state Medicaid programs have to reduce smoking prevalence, smoking-related deaths, and smoking-related medical care costs by covering all costs and removing all barriers of smoking cessation programs to their recipients. This was mandated by the Obama administration when the Affordable Care Act was passed in 2010. However, this does not mean that all Medicaid smokers are utilizing these smoking cessation services. In addition to Medicaid smokers, high rates of relapse among smokers continues to be a challenge as well. The CDC reported that in 2015, 68% of adult smokers wanted to quit. 55% of adult smokers made an attempt to quit, but only 7% quit smoking. These statistics indicate that it is necessary for healthcare providers to consistently identify smokers, encourage them to quit, and offer cessation treatment programs, as well as for insurers to promote and cover the cost of these treatments. Cigarette smoking is the leading cause of death in the United States, causing more deaths each year than HIV, illegal drug use, alcohol use, car accidents, and gun incidents combined. The plethora of health risks, disparity of users, effects of secondhand smoke, and economic burden of cigarette smoking make this our nation's most significant public health issue. Thank you.